Hello, everybody. It's Dr. Stu with another 3-minute video, hopefully cleansing some things from my mind attic. This one's on water birth from the British Journal of OBGYN from June of 2024. It's called Maternal and Neonatal Outcomes Among Spontaneous Vaginal Births Occurring in or out of the water following interpartum water immersion, the pool cohort study. It's a long title. The objective was this cohort study was aimed to establish among women using interpartum water immersion, analgesia, without antenatal or interpartum risk factors, so low-risk women, whether water birth is as safe for them and their babies as leaving the water before birth. So women that use water for analgesia, some would deliver in the water, some would deliver out of the water. They did this in the UK. There were a total of 73,229 women between January 2015 and June of 2022. None of them had anesthesia and none of them had any interventions. The analysis was done retrospectively with some prospective data as well. The primary outcomes were obstetric anal sphincter injury by parity, breaking down nullips versus multips, and then neonatal composite primary outcome of fetal or neonatal death, NICU admission, or use of antibiotics for the babies. The results showed that the rates of primary outcomes were no higher among water births compared with births out of the water. The rates of obstetric and anal sphincter injury among nulliparous women was 4.8% in the water and 5.3% out of the water. Multiparous women in the water was 1.1% for obstetric anal sphincter injury versus 1.7% out of the water. So both were slightly higher out of the water, but not statistically significant. So the same, essentially. For babies, the rates of composite adverse outcomes in the water birth group were 2.7% of the babies had either fetal neonatal death, NICU admission, or antibiotics, versus the out-of-water babies were 4.4%, so more than 1.5 times higher, again, but not statistically significant. So the conclusion, as those of you who follow the midwifery model of care and have done water birth will know, is that among women using water immersion during labor for analgesia, remaining in the pool and giving birth in water was not associated with an increase in the incidence of adverse primary maternal or neonatal outcomes. So good information to give to your clients, to let them know if they're going to birth in a hospital that does allow water birthing, that when the doctor says you need to get out for the delivery, you can at least have this information. The link will be in the show notes. And again, I hope you enjoy these sort of 3-minute rapid fire videos that I'm doing for you.